Welcome to Heart Attack Awareness. Before we begin, please take a moment to subscribe if you're new, especially if you're here supporting a mother, sister, partner, or friend. Every week, we bring you life-saving insight that could be the difference between emergency and prevention. Today, we're tackling a crucial topic: how women experience heart attacks differently than men, and why this difference costs too many lives. The truth is simple: traditional warnings like sudden, crushing chest pain are more common in men. But women, their warning signs are often subtler, more diverse, and frequently misdiagnosed. That makes recognizing them vital. 1. Atypical chest pain and pressure. Let's begin with chest symptoms because they still happen in women, just often in a different way. Instead of severe, gripping pain, women report pressure, tightness, or fullness across the chest, back, shoulder, or upper abdomen. It may feel like someone gently pressing on your chest rather than punching. This feeling can be mild, come and go, or be mistaken for indigestion or muscle ache. But resting or repositioning doesn't relieve it, especially when combined with other vague signs. 2. Unusual fatigue and weakness. One of the most common pre-heart attack signals in women is overwhelming fatigue far beyond normal tiredness. It can appear weeks before the event, progressing into a full-body exhaustion that rest can't fix. Women report feeling like they ran a marathon after climbing a few stairs or finishing household chores. The fatigue is persistent and often shows up with sleep disturbances, mood changes, or dizziness. For many women, this is the first meaningful signal, yet it's often chalked up to stress or burnout rather than heart disease. 3. Sleep disturbance and nighttime symptoms. Sleep troubles are another key sign, yet rarely connected to heart health. Women may report waking up gasping for air, with chest pressure, or experiencing unusual sweats or anxiety during the night. Change in sleeping patterns, broken sleep, or waking up feeling unrefreshed despite hours in bed can all signal heart strain. I often encourage patients to note if they're using extra pillows to breathe easier. That can signal fluid buildup or heart inefficiency. 4. Digestive symptoms misdiagnosed as GI issues. Indigestion, acid reflux, bloating, or nausea are some of the most deceptive symptoms pre-heart attack. Women frequently attribute these feelings to their stomach, especially if they occur after meals. But when digestive discomfort comes with fatigue, shortness of breath, or even light chest pressure, it's time to consider your heart. Again, these sensations don't go away with Tums, and they're often misdiagnosed until it's too late. 5. Jaw, neck, shoulder, and back discomfort. Another hallmark of women's heart symptoms? Pain in secondary areas. Instead of chest, women often experience discomfort in the jaw, inner neck, upper back, or between shoulder blades. These sensations are deep, persistent, and sometimes mistaken for arthritis or dental pain. Women describe a dull ache or tightness, but often dismiss it, especially if they have no chest pain. That dismissal can be dangerous. 6. Shortness of breath, especially with activity. Women might avoid mentioning breathlessness, especially if they appear outwardly fit. They'll say things like, "I don't get winded, but I do feel off when walking uphill." If your lungs are clear and fitness level hasn't changed, but you're suddenly breathing heavier going to the mailbox, this could be a sign your heart is struggling, not your lungs. Many women think it's just stress or aging, when it's often a silent warning. 7. Anxiety, panic, or sense something isn't right. Emotional symptoms might be the hardest to validate, yet they can be the heart's way of sending a message. Women coming to us before heart attacks often report feeling panicky, overwhelmed, or oddly anxious. It may feel like a panic attack, rapid breathing, pounding heart, nausea, but unlike mental health episodes, these often come with other physical symptoms. This overlap makes it easy to misdiagnose and miss. Putting the symptoms into context. Individually, none of these symptoms scream heart attack, but together, they form a powerful pattern. If you're experiencing unusual fatigue, disturbed sleep, discomfort in shoulders or jaw, unexplained indigestion, and mild anxiety, especially altogether, you could be on the path toward a heart event. Why these differences exist? Women often have smaller coronary arteries, and plaque builds unevenly across vessels. This means they suffer more from microvascular disease, blockages too small to be seen on a standard coronary angiogram. The result is reduced blood flow without a single large blockage, a pattern men experience less often. This makes women's heart attacks more likely to present with subtle, fluctuating symptoms rather than full-blown pain. When you should act immediately. If any of these symptoms become persistent or intensify over hours or days, don't wait. Call 911 or your local emergency services. Ask for and insist on an ECG, even if you feel your heart race or tighten isn't bad enough. A troponin blood test and echocardiogram can spot microvascular damage. Push for clear answers. Your call may prevent damage you can't feel yet. Tests that doctors may miss. Standard ECG may appear normal in women experiencing microvascular angina. A stress echocardiogram, coronary CTA, or cardiac MRI may reveal blockages or inflammation. Ask your cardiologist for stress perfusion scans or coronary flow reserve (CFR) testing to assess small vessel function. Studies show that women diagnosed with microvascular disease have similar outcomes to those with larger blockages, making early recognition vital. Real-life example, Jane's story. Jane, 55, healthy nurse, no risk factors except family history. She started waking with fatigue, mild jaw tightness, and indigestion after dinner, especially on stressful evenings. She dismissed it for weeks. One night, she woke up with tight shoulders and nausea, called 911, and was found to have microvascular ischemia via cardiac MRI. Stents weren't needed, but medication was. And she returned to full health knowing she had early disease and treated it before a heart attack occurred. Prevention and early detection tips. Pay attention to unusual patterns, not just pain. Maintain regular heart checkups after 45, earlier if family history. Monitor blood pressure and HRV, especially if symptoms shift. Adopt anti-inflammatory diet and exercise to support microvascular health. Protect sleep, reduce stress, and maintain vascular tone. Advocate for specific testing if symptoms persist. CFR, CTA, MRI. Lifestyle and treatment options. Low-dose aspirin and statin may help stabilize vulnerable vessels. Medications like ranolazine, ACE inhibitors, and beta blockers support microvascular function. Enhanced external counterpulsation, EECP, and cardiac rehab improve downstream blood flow. Mind-body techniques relieve stress-induced vascular constriction. Structured walking and low-intensity circuit training encourage small vessel function. Closing reflection. Misunderstanding how heart attacks affect women costs millions of lives. But it doesn't have to. By learning to listen to your body and by insisting on the right testing, you reclaim control. Your journals, your instincts, and your advocacy could be the difference between a silent killer and a preventable condition. Thank you for joining us on Heart Attack Awareness. If this video gave you new tools to protect a woman you love or yourself, please like, share, and subscribe. Together, we can rewrite the heart health story and empower women to recognize the signals early.